7:15 a.m. on the clock right now. Hey, good morning. This is Traxx Momentum, and of course, it's the interview of the day, which is Health on Traxx. And we are also live on Facebook right now at TRAXXfm Officials, so you can come over and say hi to our guests that we have in our studios today. We have Mrs. Nirmala, and yeah, okay, she's a pharmacist. She's a pharmacist at Hospital Sultan Idris Shah, Serdang. So good morning, Nirmala. Do I call you Nirmala?
Yes, please.
Okay, there we go. So how are you feeling today?
I'm good, I'm great.
Yeah, okay, good. So I think yesterday, right, it was World Heart Day, right? It was 29th of September. Every 29th of September, we celebrate World Heart Day. So thank you so much for being on the show with us today to talk about heart health and stuff like that. It's actually very close to my heart, lah. Okay, so heart. How many times do we have to say heart today?
I guess until the end.
Yeah. But okay, so today we're going to be talking about what kind of medicines keep your heart healthy, because like I said, it's in conjunction with World Heart Day. And but before that, okay, Nirmala, please tell us more about yourself to those of you who are tuning in, watching Facebook Live right now. Yeah, tell us more about yourself.
Yeah, thank you very much, Els. So myself, I'm Nirmala. I'm a pharmacist for the past 20 years almost at Ministry of Health. So prior to this, I've been with Hospital Kuala Lumpur Pharmacy Department, and after my postgraduate, I've been posted to Hospital Sultan Idris Shah, as you mentioned. So this has been happening since April.
Oh, so quite recent.
Yes, quite recent.
Okay. Right. So, what are you currently, doing besides being a pharmacist? Because off air we were talking about you are doing your PhD, right?
Yeah.
So, let's talk more about that first. What are you PhDing in?
Okay. So when we talk about my research work, it is mainly on the use of digital health information in improving, or shall I say, promoting self-care among patients who have both heart failure and irregular heart rhythm.
Ah.
Right. So these patients, they are on multiple medication, including a blood clot preventer.
Okay.
So that is why it is important that we make sure they take their medications on time, and they practice certain habits, like making sure they are preserving their weight, or to a certain limit that is already given to them, making sure that they take adequate amount of water and not overdoing it, because that would bring them back to the hospital.
Too much water?
Yes, too much water.
What?
As well. Yes.
Wow. Okay. So basically you're working on this digital app, right? Like an app, so where it tracks everything, like how your heart is doing, is it?
What the app does is that it is mainly for the patient. So what the patient does is that, of course, they will have their list of medical illnesses, their medications. So at the same time, like I said, they are on this blood clot preventer, right?
Okay.
So there'll be a record that they would keep for them to be able to know how many times they are within the range if they are taking warfarin. That's another type of blood thinner, and another type will be DOAC. It can be apixaban, rivaroxaban, or dabigatran.
Okay.
So if they're on this medication, then we have to monitor their kidney function. So this app, it helps to make sure both the healthcare providers and the patient, work hand in hand to manage their health. Health.
So okay, basically this app, you as a doctor or pharmacist or whatever, right? You can also track how their heart is. That is interesting. Okay, so it kind of can prevent like sudden heart failure or heart attack or whatever heart diseases, right?
The progression of the heart disease itself.
Okay, that's interesting. That's something we can all look forward to.
Yeah, thanks a lot.
Okay, so when is it out, Wati? Yeah, so you're working on that now currently, right, for your PhD. Okay, that's very interesting. So anyway, we're on Facebook Live right now at TRAXXfm Official. You can go ask your questions, anything you have about heart health. Nirmala is here to help you with it. So let's get into the interview. So when we talk about heart disease, right, because in my understanding, when we talk about heart disease, it's like heart attack.
All right.
Yeah, so what can you tell us more about like heart disease? What is exactly heart disease? And like how do people get this, how do people get this heart disease?
Okay. Thank you very much for this question. So as we are talking about heart, heart itself is a magnificent organ where it has got 4 chambers. And if you look into the heart, there can be 3 types. One, it can be structural, the valve, involving the valve, or even the shape of the heart. 2, it can involve the electrical impulses.
Right.
And thirdly, as you mentioned, heart attack, which is very commonly known, it is involving the blood supply and the coronary arteries. All right, the blood vessels in the heart itself. So as we are focusing on the third type of disease.
Yeah.
So how do people get it? It is mainly it could be due to 2 reasons, modifiable or non-modifiable risk factors. So when you talk about non-modifiable, it'll be age. As we age, we tend to get this disease. Gender.
Okay.
Our male counterparts, they tend to have higher risk compared to female.
Really?
Yes, it's a male-dominated disease, I would say. However, women at their postmenopausal stage, we have almost similar risk as well. All right. And lastly, it'll be genetics. Family history.
Right.
So you have a strong family history, so the higher the risk of you getting, this heart disease. So that is for non-modifiable. So when you talk about modifiable, this is where we can work a lot. So we have got diabetes, hypertension, high cholesterol, and of course the upcoming obesity. So when all this 4 is together in an individual. So what statistics is saying, about 2.5% of our people, they have all these 4 conditions. It looks small, but when you put it in an actual number, it's over a million.
Wow.
In Malaysia itself,
2.5%.
which is equivalent to over a million.
Wow.
This is based on our recent NHMS 2023 statistics. Yeah. So
that is quite alarming, actually.
True.
That's alarming, yeah. The whole reason why this topic is very close to my heart is because recently one of my friends, my close friends, he actually kind of went through a heart bypass. Do you call it bypass?
Yes.
Yeah, correct. So he went through bypass, and then it was very surprising, shocking, because it's like he exercises and then he keeps healthy. But what is the cause there? And then for me, right, because I don't know much about this whole thing, so I'm like, they don't call it an attack for no reason. It's like heart attack, right? Yeah, correct. So, So just now you did mention a little bit about the contributing factors to the disease, right? So mainly we're talking about heart attack, right? Okay?
Yes.
Yeah. So I think all of us have seen a lot of news nowadays about like a 30-year-old young guy, whatever, building muscles, going gym, whatever, suffer heart attack. So why is this?
Okay, there could be many reasons. And remember, as I was telling you, as per the survey initially, they also found out that not everybody know their underlying medical condition, because not all of us do our health screening. All right. So for the diabetes, 2 in 5 of those who they surveyed did not know they had diabetes in the first place. 12% for hypertension, and 1 in 2 for those with high cholesterol. Right. So they didn't know.
Okay.
So if although they may have been leading a healthy lifestyle, but if they don't do a health screening, once they've already surpassed their 35 years of age, it's important that they find out more and do something about it. It is not just about maintaining a healthy lifestyle. Remember, I said there can be many other reasons that could lead.
Yeah, correct.
True.
So you mentioned that the diabetes means like high blood sugar level, right?
True.
So that is, could you say it's the main contributing factor to heart attack?
It is one of the many. Of course, it's one of the biggest contributors.
I see.
But,
all right. Okay.
As I mentioned, the 3+1, as quoted in our NHMS, the diabetes, the hypertension, and high cholesterol. And now, thirdly, the obesity.
Yeah, correct. Understand. So the other day, I think it was like a couple of months ago, I did a health screening here in RTM because we had like a health screening thing, right?
All right.
And then I've always suffered with high cholesterol.
Okay.
Yeah. Information nobody needs to know. Sorry, Dad, that I shared this. But yeah, I suffer with like borderline high cholesterol kind of thing.
All right.
And then so I've been like always working out, looking after my diet kind of thing to bring it back down and then so I went to this health thing. So first thing, then they say, oh wow, okay, you lost weight, okay, your cholesterol is back to normal. Macam your blood sugar level higher. Why? I say, but I don't even take sugar. So and then I went to another doctor and he said it's the insulin. So you cannot just check the blood sugar, right? There's some kind of insulin thing that we need to check, right?
So like I mentioned, is health screening. It is not just the superficial finger pricking and so on. It is the total blood works. So you got to go and see a doctor, and with these lab investigations that you have, then they'll be able to advise you what to do next or when to repeat again your blood levels. So that way you can keep yourselves checked.
All right.
Yeah, it can be any of these four.
Right. Okay, cool. So that's something we all need to look out for. So the common signs and symptoms, right? Diabetes, hypertension, and then high cholesterol and obesity. So those are the four things. So that's why we all need to do regular health screening, right? So how often do you recommend it?
Okay, the moment you have high family risk, you have got this family history, so and you're aging, and probably close family itself, they're already showing some form of symptoms already. They have underlying diabetes, hypertension. It's about time. At 35 and above, you start your check. 35. Of course, we also have the B40 screenings in our health clinics. Make use of all these campaigns that are available and get yourself checked.
Yeah, very important. So coming back, we'll talk more about some of the treatments that are available when it comes to heart diseases and stuff like that. So if you have any questions relating to heart disease, if you have any experiences you would like to share and ask your questions, Nirmala is here to help you out. She's PhDing in stuff that will help you out in the future as well. So we're on Facebook Live at TRAXXfm Official. Make sure you go head on over. You can say hi, ask your questions, and she will be happy to answer it, right? Anyway, of course, we're taking a short break and we're going to play one for your daughter.
Thank you so much.
Shout out to her. What's her name?
Her name is Devina and my son's name is Jayendra.
All right, there we go. We've got your song coming up.
Thank you very much.
11:30 a.m. on the clock right now. This is Traxx Momentum, and it's the interview of the day. Yeah, health on Traxx. We're talking about what kind of medicines keep your heart healthy in conjunction with World Health Day, which is every September 29th. So thank you, Nirmala, for being here today with us and sharing your insights and stuff like that. Because, like I said, it's very close to my heart because one of my really good friends, right, he recently went through like a little surgery, I would say. Yeah, maybe not so little. But just now, earlier on, I did as well ask, to those of you tuning in right now, if you have any questions relating to heart health and stuff like that, that Nirmala can answer for us, right? So this one coming in from TikTok Live, Najib says, what causes healthy people, even active athletes, to have fatal heart attacks? So this is something we kind of touched on as well just now, right? So yeah, just quickly, like, how to say, answering back to those factors, the contributing factors, yeah.
So, although these individuals, they may look healthy, so there are a couple of things that we need to think. Yeah, they may lead a healthy lifestyle, no smoking, good exercise amount, but there are other contributing factors that could affect their health outcomes. And knowing that heart attack is a silent disease, a silent killer.
Correct.
So it just manifests suddenly. Okay, so we do not know what is their underlying cholesterol level. Like I said earlier, there can be many factors. So if we do not do a health screening, we do not know what is our underlying sugar level, as you mentioned. At one point, maybe the cholesterol is high. As you're managing that, and suddenly you realize the sugar starts to shoot.
Yeah, correct.
All right. And if you were to do a blood pressure checks and you realize, it's from the normal usual level, it's suddenly getting higher and higher day by day.
Okay.
And we all know there's one of the major modifiable factor will be the stress. Okay. And living in an urban lifestyle, and undergoing a lot of stress, that itself subjects us to heart disease.
Right.
So it is a factor that has been acknowledged, and it is important that we manage our stress. And like I said, and I would always emphasize something that we all should do: health screening and check with the doctors. Okay, and get their advice. If it's normal, then when should we repeat it again? If it's not, then how we can improve that.
Right.
So perhaps a therapeutic lifestyle modification. Okay, they would advise us what we can do on that. We can consult our dietitian, physiotherapists, and accordingly, if we are already medicating, so that's where the pharmacist comes in and tells you, how to take it in a best way.
Right.
And from there, how you can monitor your blood pressure, your sugar, your cholesterol levels, which the doctor would then also, advise you when to do your blood tests regularly.
Okay.
So although all of us, most of us will be leading a healthy lifestyle, knowing that we are moving towards that. But that's the thing. We do not know what's happening in the in.
Correct.
Right.
And just now off air as well, we had a little chance to talk about this, which you mentioned, which I think our listeners should know as well. You said as early as 9 years old.
Yes, as early as 9 years old, as I mentioned. What science have shown in terms of researchers, the fatty acid layer, it has already started to line our coronary arteries. Our
As
blood
young
vessels.
as 9 years old.
This is because we have already started to expose ourselves to fast food, all right, unhealthy diet, even as young as 9 or even younger, all right. And what about sedentary lifestyle? Even statistics is saying that 1 in 2 of Malaysians, right, we are leading a sedentary lifestyle.
Means not exercising.
Not sitting more than 2 hours, for example.
Okay,
all right. Not
right.
only just not exercising, and they tend to even recline while being awake. So it is in a term that is commonly said, couch potatoes.
Right. Yeah, of course.
We wouldn't want to do that. And probably distracted with our phone for
Yeah.
a long period of time.
Correct.
So all this eventually contributes to heart disease.
I see. Yeah. I feel like whatever you are saying today, right? A lot of us will like, oh yeah, we've heard of this. Yeah.
Yes.
But then we never do anything about it. Right. So anyway, coming back to thank you so much for answering the question. I hope Najib, I hope you got your answer right there. So yeah, if you want to watch this interview, you can head on over to our Facebook at TRAXXfm Official. We're live right now. You can ask your questions and stuff like that. So coming back to the interview, what are the types of treatment available besides surgery? Okay, please. Yeah.
Of course, surgery is one of the treatment modality, and the next would be medication. And these patients who suffer from heart attack, they tend to be on these medications for lifelong unless advise otherwise. So the 5 common types, all right. The first would be what we call the blood clot preventers, or they are more commonly said as the blood thinners. They can compromise your aspirin, clopidogrel, ticagrelor. Usually they'll be initiated with 2. And then depending on their bleeding risk and their, of course, risk of getting another blood clot. So this duration may prolong, from 1 month to about 1 year.
Right.
And then they'll be continued with a single agent.
Okay.
Which is commonly an aspirin. And then there are 3 others, which is the first one would be a beta blocker, or a medication that regulates the heart rate. Okay. The third one, which is what we call as the ACE inhibitors or the angiotensin receptor blockers. What they do, they will open up the blood vessels. At the same time, they prevent the heart, what we call as cardiac remodeling.
Right.
So we prevent the heart from getting big, for example. And lastly, it is statins.
Right.
And these medications are used to regulate our cholesterol level, the bad cholesterol level, we call it LDL. Besides that, it also stabilizes our plaques.
Right.
Okay. The atherosclerotic plaques. Remember, I was telling you the fatty acid lining.
The layer,
right?
yeah,
The
correct.
layer. So there are calcifications that build around it. So if at the point of stress, and this calcified layer, they break. So this fatty acid, the fatty layer actually spills out. So our body perceives it as bleeding. So the platelets, they will go and stick to this, the fatty. The slurry there.
Yeah.
So as they stick and they stabilize it, thinking it's a clot. So thinking it's a bleeding, so it forms like a little clot. Okay. So they are known as thrombus. When they break at a friction, because our blood flow is always consistent, isn't it?
Correct.
If it were to break and it goes to our heart, it becomes a embolus. So it's like a bullet. So when it goes through to the narrower blood vessels and it obstructs there, that's where it becomes heart attack. If it goes to the brain, it becomes a stroke.
Oh my gosh, I see. So what you're saying is like, okay, that layer, right, we're talking about, let's say it bocor lah, right?
Yes, you're right.
Correct. It bocor, and then some unhealthy stuff in our body will go and plaster it together.
No, it's the platelets. So they are programmed by our body to stop the bleeding. So when you have a little cut, platelets are the first ones to come and rescue us.
Correct.
So they will stop the bleeding. So thinking there is a bleeding, they will go and secure
Rebuild
that
it.
area.
Okay,
secure that area.
Okay.
So as they secure, they will build this wall, right? Like a little, like a ball shape, or it's not really a ball, but it's like a disformed ball. So they're probably hanging at that edge there. So as the blood flows, and like I said, there are many other inflammatory markers that may, at that point of time, if at all if there's a friction and it breaks, this thrombus or the blood clot, it breaks and it travels. So from a bigger blood vessel, and we all know it will branch out to become smaller ones.
Yeah,
so it would just go and obstruct.
Oh, that's how the thing happened lah. The like heart attack and stuff like that.
Yes.
Yeah. Okay. Cool.
Probably, if it's all right, I can just mention some of the common symptoms that the patient may experience.
Yes. I want to see whether, because like I said, right, my friend, thankfully alive and well. He was talking about, because I asked, how did it happen? Did you just, or something? Because it's an attack, right? What we see on movies probably different, right? So in my head, it's like, oh my god, you got a heart attack. How did you just
fall down?
Yeah, fall down or something. But no. So okay, please do explain the common symptoms that you see.
Okay, as I mentioned, it could be a silent event. Okay, although the patient may not experience anything, but in majority of the cases, patient will experience chest pain. It's generally crushing in nature. Okay, and it usually accompanied by shortness of breath.
Okay,
nausea, vomiting, profuse sweating. So when all this happens, and this chest pain, it can actually even travel to the arm, to the back, to the jaw. Okay, so if it happens such a way, it is something they should, we all should do something about. So they should go to the nearest hospital, preferably, and get the doctor to help them. All right. So Other than this, for some patients with diabetic or even elderly, they may experience somewhat like a gastric discomfort. So it may not present as a chest pain, or even ladies, for example. So they may not get chest pain, a true chest pain, like I described earlier. So a little bit of gastric discomfort. So when they have that, they may think it's just gastric and dismiss it off. And 2 days or 3 days later, probably they'll just pass out, and they may even die out of that. Time equals to heart cells that we can save. The earlier we go, the more the heart cells that we can save. So it's very important that the moment they have any of the symptoms, get themselves checked. Don't just go and get themselves medicated or pick up something from the shop.
Right.
Some Panadol. It wouldn't work.
I
shouldn't be that way.
Yes, of course. Everything you just mentioned, right, was everything my friend told me he experienced. Because in movies, right, was it your right arm starts to feel numb, or left arm? I forgot.
It's the heart is on your left.
Or left.
Side.
So left hand starts.
Usually it's on the left, but some it may actually radiate to to the back.
Yeah, correct.
Yeah.
So in my understanding, which I know to those of you tuning in right now, some of you still have this kind of understanding, so I'm not ashamed to say it. I always think like when you're about to suffer a heart attack, right, your left arm goes numb and that's it. So you'll know. But then when my friend told me, it's like much more complicated than that. He's starting to sweat, and then I'm like, but I sweat a lot. And then he said, I'm starting to ache. I said, but I ache a lot. But then he said it's a different ache, and he can't really move his arm, right?
Yes, it's kind of like a crushing, like somebody sitting on your chest.
Okay.
Very heavy.
Right. There we go. So just now you mentioned all the medicines and all that already.
Yeah.
So preventive measures as well. So I want to ask one personal question of mine, because I suffer from migraine.
All right.
Okay. And then I normally take paracetamol.
All right.
Does that cause the blood to have any hoo-ha effect? Paracetamol
on its own, it wouldn't.
Okay.
And it depends on the amount that you're taking, you see. So if you're just taking 2 tablets maximum in a day or in a month, that shouldn't be harmful at all. It's a very common medication that is sold, what we say as the over-the-counter product.
Correct.
That is used for pain, general pain, fever.
Correct. All right. Okay, cool. You want to talk more about the
preventive? If we can move on to the preventive, because we all know prevention is better than cure.
Of course.
All right. So I've got a little mnemonic for this prevention. Like I will say, all we have to do is smile.
Ooh.
All right.
Okay.
So what this smile stands as for: sleep sufficiently. Okay, at least 8 hours and above. What we gathered from our NHMS survey: 2 in 5 Malaysians do not get enough sleep.
Yes. Agreed.
Okay, so that is very important. So you may be healthy, practicing exercise, eating well, but you're not getting enough sleep. That's harmful as well. And no smoking.
Okay, yes.
All right.
Yes.
That should be a number 1 no. And number 3 is stress relief activities.
Okay.
So do whatever suits you.
Okay.
Gardening, reading, little traveling 2 to 3 months once. All right. So we are moving on from S to M. M, meditate. If it can be in any form. It doesn't have to be you sitting in a lotus position, putting your hands out, eyes closed. No, even as you drive, if you have a focused, a mind, and you just do it for that 1 hour, thinking positive thoughts, that should be good.
Right.
Okay? And medicate. As a pharmacist, I would always say, if you're already on regular medications, then it's important that you adhere to the regime as what the doctors and the pharmacists has advised.
Okay.
I interact. We are a social creature.
Correct.
So it's important that we interact every day, be it with humans, animals, or even nature.
Right. Okay, cool. All right.
L, love yourself. So it's important to health screening. So, okay. And learn to do something new. You can always find new things to do. Keep ourselves agile.
Correct.
And E, the last one, eating well and exercising adequately. So if you smile, your heart will smile back.
I think the exercising one is okay for me, but the eating one, I love food. I cannot.
Yeah, we are spoiled with choices.
Yeah, man. So what's the advice here that you can give me and to those of you who are foodies out there, including my producers?
We have got this, the concept suku-suku separuh, for a start.
You see, she's already rolling her eyes like, I don't want to listen to this. Okay, yes.
Yeah, for a start, we can do that. It's not entirely we have to, miss out on the carbs. Slowly and gradually, we can replace it with something a little bit healthier.
Right.
But for a start, when we have, quarter portion of carb, quarter portion of, our protein, and, a half portion of our fruits and vegetables,
Yeah.
for increased fiber, all that helps.
I see. I recently just got into green juice.
Oh.
Because I want to be that Instagram girl. But then I never really, I did it twice and that's it. Yeah. So, all right. We're coming to the end of the interview. So, what is the Ministry of Health's initiative to ensure our public pays more attention to their heart care, and your advice, your personal advice to the public and also to those of you tuning in right now?
All right. Thank you very much. I think this is a very relevant question in the current era because there's so much the ministry is doing, especially even in not only in Ministry of Health, Ministry of Education. There's a lot of collaborations that's taking place. We have to start young as well. Even in younger children, we should advocate on healthy eating. All right, and adequate exercising.
Yeah.
And as we move out to the adults, like you say, they are like this month itself, September. Today is the last day. It is known as our Malaysia Wellness Month. Probably not everybody would know this. It's Bulan Malaysia Sihat Sejahtera. It's initiative under the National Agenda for a Healthy Malaysia by our ministry. And all these activities is part of the promotional activities as well.
Right.
B40 health screening campaigns and World Heart Day we are celebrating all together. From time to time you can see even hospitals, pharmacists, dental clinics, everywhere that they are healthcare professional or providers, they would always talk about heart health. Okay, and you and I, publics, when we see the social media, there's always a podcast or some form of
correct
activities that is promoting on health awareness.
And recently we had this how to say the sugar drinks are less 20% cheaper 20 cents cheaper
Okay.
if you go to the mama or whatever, right? So I mean I'm gonna get a lot of hate for this, but I love that initiative. I love it because meaning don't take sugar.
True.
Right? That's the one, right?
Yeah, we should move towards healthy eating, mindful eating, to put it forward. Because what we put inside is what,
correct,
we're going to project it outside eventually.
Yes. Yeah. Any other things you would like to share here?
Okay, so we may not be able to answer all questions during this session, but feel free to call our National Pharmacy Call Center at 1-800-886722. So at this line, which is available Monday to Friday within working hours 8 to 5, except public holidays, they can always make a call and ask further about heart related medication or anything at all that is within this health field. And please, of course, follow us on Kenali Ubat Anda Facebook, Instagram and TikTok accounts, so that they can get the latest updates on medication or health related information. Right.
It's wonderful initiative and everything is good because like you mentioned, I did see a lot of hospitals taking the initiative to do a lot of health screenings for the public. Free one.
Yes.
So please take advantage of that, okay? Anyway, like I said, if you have more questions, I'm sure Nirmala will be happy to answer them on Facebook, so you can leave them all on there at TRAXXfm Official. But we have come to the end of this interview. It's very interesting. Thank you so much for educating me today about heart health, So thank you. And we've been speaking to Nirmala, a pharmacist at Hospital Sultan Idris Shah, Serdang. And if you've missed out on that, you can head on over to our Facebook page at TRAXXfm Official to check the whole interview out. Thank you very much. We've got the news coming up at 12. Be back after that.